And a big thank you to Desert Financial for sponsoring the KRIM Community Spotlight Program. Good morning, everyone. Chris Higgins in the studio. Hope everyone's having a wonderful Wednesday morning. I think it's still going to be a little warm out there today, but it's supposed to be cooling off. And who knows, we might see some rain this weekend. Wouldn't that be great? Again, for everyone to keep our firefighters in our thoughts and prayers, and everyone in the Flagstaff area with the fires going on up there. And we just really thank them for everything they do for protecting our communities and keeping our communities safe. And also very thankful for our guests in the studio this morning. And we have Banner Payson Medical Center, and we have CEO Hoyt Skabelund, and Sheree Perry, the Senior Quality Manager, and she is an RN and BSN. Thank you so much, both of you, for coming in this morning.
Thank you. Thanks for having us.
Oh, you're so welcome. And really appreciate all you do, your staff, faculty, everyone at Banner, for keeping our community healthy and being there for our community. So really appreciate all of your efforts.
Thank you.
And everything you do. And we're going to learn today about your position and the quality manager, senior quality manager, what is involved in that. What that means, what you do, and the impact that has on Banner Payson Medical Center. But first, I guess a little bit about you, Sheree.
Well, I've worked with Banner since 1984.
Mm-hmm.
I am a registered nurse, and my background where I first started as a nurse was in intensive care. Mm-hmm. And I did that for about 10 years. And after that 10 years, I did management as well at that time as a charge nurse in the ICU, and worked both variety of days and nights because I had young children.
Uh-huh.
The beauty about nursing is there's many, many different hours and shifts you can work. So that was a great start for me in Banner. And after that, I went into house supervision, which basically is on the off hours. You're in charge of the hospital. You're kind of the administrative contact. I did that for a number of years. After that, I went into the home health part of Banner, and I was a director of nursing over the nurses and aides that went out into the community, in particular in the Mesa, Chandler, Tempe area, and saw patients. And I did that for, I'd say, 5 or 6 years. You can see that I like to change jobs because I like to do different things, but Banner's allowed me to do that with them. So I'm very, very lucky that way. Mm-hmm. And then after that, I did some travel nurse supervising for a number of years, and then went into quality. Mm-hmm. And quality has been kind of my bailiwick of what I really enjoy doing. And I did that at first with home health, and then at the Banner Heart Hospital, which is in East Mesa next to Banner Baywood.
Okay.
So that's a little bit about my background. I've been now in Payson for about 3 years.
Okay.
And I came here because I have a home in Forest Lakes, and I love the mountains, and I just love being here. And I have a horse, so it just works out very, very well for me to be able to work in Payson.
Where were you raised, Sheree?
I was born in right outside of Minneapolis, and actually lived in a number of states in the Midwest. My dad was a minister, a Presbyterian minister, so he had a few churches in the Midwest, and so I lived in Iowa and South Dakota and Nebraska as a kid, and then came to the Mesa area in high school. So that's kind of a little bit about my background.
Wow. Yeah, very diverse background.
Yes,
for sure.
yes. But that's the beauty of our company, is I have the ability to change and do new things that challenge me, and I've really, really enjoyed that about our company.
I think it's in this role that Sheree's in, that broad background from intensive care to being a house supervisor. A house supervisor is an illustrious role. Every administrator and director of nursing love having talented after-hours house supervisors, and they typically are seen as experts of everything. So to intensive care, house supervisor, and then home care, which is to see patients after their hospitalization, provides a great background and has made, I think, helps explain why Sheree is so very effective at guiding our quality improvement efforts. Awesome.
And now, with the quality improvement, that touches or involves every single department in the hospital?
It
Yes.
does. It
Oh
involves
my
all of our
gosh.
departments. It involves, of course, our areas where our nurses are, but
Mhm,
also it involves looking at where and what our physicians are doing as well.
mhm,
We have many, many regulations and standards and best practices nationally that we should be following.
mhm.
And so we drive that through our quality department for the most part, I would say.
Mhm. And how big is your team? How many members on
Great
your
point.
team?
Probably 30 plus departments,
Mm-hmm.
and they all will come to the meetings that Sheree hosts and give a report in some type of sequence and frequency.
Mm.
So
Yep.
that's how she reaches each department, and
Yep, every department has its own quality measures that they're looking at.
Yes.
And usually it supports the business that they do and the
Mhm.
patients that they take care of. And so we look at areas that there might be risk or something that we don't do very often so that we make sure that we're doing the best that we can be doing each time we do that procedure or that surgery or that patient treatment for that patient that's in the hospital with us.
Mhm. So that is, I guess, one aspect and one component is looking at each department and the procedures and how things are done.
Yes.
And then before the program, you mentioned, Hoyt, the patients and talking with the patients to see, how they felt, the service was
Yes.
and their experience
Yes.
at Banner Payson Medical Center. So that's another really big component
It
of
is.
quality management.
It is, yes. Medicare actually measures patient experience or patient satisfaction at about 22% of what kind of rating that they give us.
Okay.
And so when we get those results, we look and see how we're being rated, and then we try to improve that. And so one of the things that both Hoyt and I do is we round and see patients every week. Typically, all of our leaders do. We try to reach out and talk to patients because we don't know how a patient feels about us if we're not speaking directly with them about
Yes.
their experience and what we're doing well and maybe what we need to improve at.
Mhm.
And not just the patient, but also their family members.
Mhm.
So that's a big, that patient experience piece, because that's almost a quarter of how we're rated by Medicare, is a critical component to us doing very well with our patients and making sure that they're happy when they're in the hospital, as happy as you can be.
Yes.
So.
Yeah. No, that's very important, that communication. And having that communication, because it's easy for any company sometimes to say, oh, we're doing good, and and tell themselves that they're doing good.
that's right.
But
Right.
the true test is their customer,
Amen.
Yes.
the patient.
And how they respond to usually a telephone call or a written survey. How they respond to that is very, very important, because that tells us then how they view us.
Mhm.
But the time for us to identify any issues that we're doing well or that we're not doing well at is while they're in the hospital,
Mhm.
so that we can make sure that they are having a good experience with us and that we're answering their questions and making sure that they understand their treatment
Mhm.
and why they're there and what we're doing and what they should do when they go home, so that they can take good care of themselves at home.
Mhm. Yeah, there's and how long again have you been in quality management, did you say?
I would say, if I think back, probably I went into the home care quality management in about quality improvement in about 2005.
2005.
So I've done it since then, and
Yeah.
been at Banner Payson for the last 3 years. Yes.
So because this is such a broad area, field here, you said, early on you were changing, and moving around into different areas. It sounds like quality management has really found your niche.
Yes.
And the fact that you're involved with, so many different departments and doing so many different things, it presents the kind of challenges, change, that kind of has kept you in this area for this many years.
Yes, it's just very interesting and fascinating work, I think. And I guess the other thing I would say is because we're a smaller team in a little community that can get critical patients in, we pull together to get the job done. And I don't see the what I would call any hierarchy. I mean, we work together as a great team so that we're doing the best that we can for our patients. And I think that's what I like about a small hospital is every time you pass somebody in the hallway, you typically know who they are, or you know if they're not someone that's normally working there. So those things are really good because you've got that relationship, and I think getting work done and doing the best that we can do is all about your relationships with your team.
And Hoyt, I mean, this is just another example. Every month you bring someone in, or we have a guest from Banner Payson Medical Center. I think that just exemplifies and talks about team and the Banner team, and that is critical for Banner to operate at the level it operates at.
We tease Sheree, and then there's Carol Grush, who's joined us on a program. She's the infection prevention specialist.
Okay.
These two ladies are experts in their field, and it would be rare in a small rural hospital to attract this level of talent. Fortunately, they love mountains.
Yes,
they love Banner,
very much
they
so.
love Payson.
Both, yes.
So we're in a really good. So we tease them that once they signed up, did we not tell them that there's no leaving? This is the Hotel California. You're
forever.
staying. You're forever.
Yeah.
And to me, this subject we're talking about today is Banner's strength, and not something that I think a member of the public would necessarily know of. But Banner has been touted internationally and nationally for its dedication and level of detail and innovation relating to quality improvement, going beyond what the regulated requirements are,
Yes.
going at being at the cutting edge of improvements, and it might be helpful to there's so much we could share,
Yes.
but I think maybe Sheree, is there something that a listener might be fascinated to hear about the level of detail that we focus on to try to provide the best care in the world, based on world knowledge?
I mean, just something to me that Hoyt and I were talking about that's just very simple, but one of the things that we really look at is how can we make sure that when patients have surgery that they don't develop pneumonia after surgery. And I think typically most people know that, well, I need to get up and I need to walk. That's important. And yes, that's true. It is very important to get up and walk. And I need to be deep breathing and I need to be coughing and those kinds of things. But Banner identified with national input and standards that really oral care, which is brushing your teeth twice a day, is critical to preventing pneumonia. So we have been studying that very carefully, making sure that yes, we're doing it and we're documenting it, because for nursing staff, the proof that you've done something is that you actually documented it. So that's an easy report that we can run out of our computer system, because all of our charting is in the computer. And then we can see, are we having patients brush their teeth twice daily so that they don't get postoperative pneumonia. And knock on wood, we have not had any of those cases. We're doing very, very well.
Wow.
And not just how is Banner Payson doing, but how are all the facilities in Banner doing. And so then we have weekly, monthly calls depending on which measure we're looking at, and we can look at, okay, who's doing well, what are they doing, how do we get everybody else in the whole Banner system doing well. So we not only look at a local level, but we look at it at a global level as well. And I think that that's really important, because there's a lot of sharing of information and best practices that we can identify. Maybe we put a little sign on the mirror that just describes to the patient why it's important to brush their teeth. But that's just a small one measure that we're looking at right now that's important to us.
We call them bundles.
Yes.
Meaning there's a bundle of items to prevent post-surgical infection.
Correct.
And it gets really detailed.
It's very detailed.
As a non-nurse and a non-clinician,
Yeah.
it's quite intimidating to read the list. So I'm becoming familiar with the lingo, and
Yes.
I'll ask, what does that mean? It's amazing that very little is not intentional.
Correct.
So from the moment that we're pre-screening you for surgery to the moment that you're going home and with the discharge instructions, there's
a number of things
many
that should
items.
happen, yes. You know, and some other items, for instance, that would go along in that bundle is how quickly did we give the antibiotic in surgery and timely, and was it the right antibiotic? And how did we clean the skin prior to surgery? So there's just a number of things in that bundle. What kind of education did we give the patient before they went home and their family so that they know how to take care of their incision once they get home? Because part of that post-operative infection isn't just your time in the hospital, it's when you discharge. We certainly want you to do well at home with your physician that you see in your community or in our community. And I just think that this bundling of care and looking at these specific measures and expectations and making sure that we measure it, because, you know, the old saying, you know, what gets measured gets improved. It's just the truth.
Yeah.
It's just the truth.
The other, I feel, great advantage or benefit with Banner here in Payson is you're not operating the medical center kind of in a silo.
No.
It's not like you're on your own and figuring everything out on your own, but you're able to tap into the Banner network.
Yes.
And a great example was our last guest with the tele-ICU doctor, and just the level of experience. And I can see, Sheree, it's the same with quality management, because you're not just working your team here independently, but you're working with all of the quality management teams at all the Banner facilities.
Yes.
And sharing information and
Yes.
your measurements, your findings, what you're seeing,
Yes.
and all working together to provide the highest level of service to Payson patients.
You know,
Right.
what's interesting is as I make presentations in the community and talk with people one-on-one, and then read online across the country, there's such a feeling now that hospitals are out to make money at the expense of the patient and not the folks on the patient. And I'm sure that exists in other in certain health systems. We're not for profit. We've lowered our prices 3 times since we've acquired the hospital, and we need to be sustainable, so we have to make some money.
Yes.
But at Banner, I would say we spend the vast majority of our management time on clinical quality, patient experience, and employee experience, how they're feeling.
Right.
And we do work on the financial things. That's where I spend most of my time. But it's really kind of quiet behind the scenes. But most of our resources are spent and dedicated to improving the care we provide, the evidence-based practice, what's the best known treatment we can provide. So if you're a surgery patient and we're asking you to brush your teeth, it's not because we think that you have poor hygiene or bad habits. It's because and hopefully as we message these things to our patients, we explain to them why.
Yes.
Listen, we have learned, science has shown that brushing your teeth twice a day will help prevent an unwanted infection. And so we're going to be following up with you. Please don't feel like we're being your mother.
Right.
We're trying to help you be safe. And so we have to message all these complicated little intentional things, and it's impressive.
And it is a case where you're constantly learning as well.
Right.
To where, there's new challenges, new things that you're introduced to, and so you're learning.
Yes.
The pandemic was a great example of that. We were learning as a health system from other countries, from other health systems, other parts of this country, and then within our own 30-plus hospitals, we were learning, and Sheree and others were a part of real-time identifying best practice based on scientific results. It was a fascinating process.
Yes.
We should talk about the clinical term is STEMI.
Oh, yes.
Care of a patient with a STEMI. This is another interesting.
STEMI really stands for what we call an ST elevation MI, which is a heart attack. And on the EKG, there's a specific wave that elevates many times when you're actively having a heart attack. So we call it an ST elevation MI. But basically this means you're having a heart attack, and if we can quickly get you to a cath lab where we can intervene on your arteries in your heart, we hopefully can prevent more damage or minimize any damage. So the key to that, though, is identifying the fact that the patient has that on the EKG very quickly. So we try and work very hard to get an EKG within 5 minutes of a patient arriving with chest pain to our emergency department. That is our gold standard. We want to do that in 5 minutes. The ED doctor or the emergency department doctor then quickly looks, confirms, and the advantage of us being a part of a big health system is that we can then hopefully put them on a helicopter almost immediately and send them to either Banner Heart Hospital or Banner Desert or Banner Good Samaritan, where there is a cath lab, and that's a lab where they can go in and intervene on those arteries in your heart and take that blockage out. And we want to do that within 120 minutes. And really the standard at the local level is if you've got a cath lab in your hospital, for instance, like at Banner Baywood, there's a heart hospital right next door, they try to get to the cath lab in 90 minutes.
Wow.
Well, because we know 90 minutes is really better than 120, try very hard to get our patients from here, from the emergency department, to the hospital, to the cath lab within 90 minutes. That's really our goal. Now, we don't always meet that, but typically we meet the 120 minutes pretty well. And so that's been one of our focuses since I've come, is to study those patients. We probably get 1 or 2 patients having a heart attack a month in our emergency department.
Wow.
And it is life-saving, because if you can get in and unblock that artery, you can stop the damage that's happening to their heart. So it's something that's very, very critical. It's a high technical procedure. However, it's very effective if we can get it done quickly. And so we know why that's so important, and our teams work together both at Banner Payson and Banner Good Samaritan in particular to try to make that happen. And that's been some of our work this last 3 years.
Yeah, I was presenting to the American Legion and giving a brief hospital update, and I was asked, why don't we have a cath lab here? Make that happen. I wish we could, but it's not practical from the standpoint of there aren't enough cardiac surgeons who are skilled in this. We don't have the volume of two a month. Do you have a cath lab that costs you, $1 million plus, and you only use it 24 times a year? It'd be worth it if you could do that, but there are just not enough professionals. So knowing that constraint, we want to be the best possible at this distance from a cath lab. It's amazing work to get a patient from arrival in the emergency department into a cath lab from Payson in 90 minutes.
And we have done that more than once.
Near miracle.
Yes.
And so every second counts. And so we essentially have stopwatches on our computer and our mind, and we have the electronic health record helps guide and update, and we communicate with our Banner transfer services, whichever air service is available at the moment. And it's an amazing orchestration, just like the military does in the field of battle. Similar, we treat it with the same honor and
level of urgency.
And exactness.
And it pretty much takes everybody on the team that's seeing that patient, to recognize and work on it together. But we've been successful with that, and I truly believe that the fact that we're part of the big system, the big Banner system, it has really truly helped us improve how we manage and treat patients having a heart attack.
Wow. Yeah, and what comes to mind is being down at Banner Desert not too long ago, and just in the emergency room, oh my gosh. I, kind of was walked through, and thought, wait a second, this is still the ER?
Yes.
It's still the
I think Banner Desert is the busiest emergencies department in the state, I believe.
So I couldn't believe the size. So when you're talking about that, response, and they, are looking at maybe a 90-minute, but so much of that because of the volume and how many people, you don't have maybe the doctors or nurses on you right away because there are so many other people in their patients.
All about triage and priority.
Yeah. So the fact that we have that distance, you can't get past that, but depending on the state of the ER here
Mhm.
in Payson, you could get, I guess that could be diagnosed a lot quicker than maybe in the valley.
There are some great advantages
Yeah.
of being smaller. I mean, we can know everybody by name.
Right.
We have, typically we will have more one-on-one time.
Mhm.
There are times when we're overwhelmed with patients in the ED and we'll have multiple, rarely, but multiple life-threatening conditions. And this is where the evidence-based practice that Banner and other health systems have brought to bear today. There's some of the U.S. often gets criticized for not having, for the cost of care,
Mhm.
but our quality of care, often they'll say, oh, the quality of life sounds good. We flex our muscles with our freedom to choose.
Mhm.
If I want to drink alcohol, I'm drinking alcohol. If I want to eat donuts, I'm eating donuts. Well, in the healthcare side, I would say that we're second to none in quality in the United States of America when it comes to our ability to apply evidence-based practice. And in Payson, I would also say that in a rare rural setting with limited resources, we are one of the top hospitals in the state, and we are in the top 25% of hospitals in the country, and some measures in the top 10%, and some in the very top percent, depending on, this is what Sheree measures and guides us through, but we focus on what needs improvement,
Yes.
and we focus on maintaining excellent quality. I wish there were enough cardiac surgeons, enough cardiac cath lab staff that we could spend the money and it would be a matter of just investment. That's unfortunately not the case.
Mhm.
We will not be able, in the foreseeable future, this country will not have enough cath lab staff to operate a cath lab in Payson, or we would be doing it already.
Yes, but like you've explained, it's comes down to how quickly you can get
Yes.
to one.
Yes.
Not necessarily if you're right next to one or by one, because
Okay.
even in the valley, like you said, their goal is 90
Their
minutes
goal is 90
when they're
minutes.
right next to one.
Correct.
And
Yes.
thus the investment in Banner Air.
Yes.
So that we
Yeah.
can have on the same electronic health systems, the same Banner transfer services. If it saves 1 minute,
Mhm.
that's the type of commitment we're doing.
Yeah, well, and you have to
Wow.
figure that the helicopter ride itself from our emergency department to Banner University or Good Samaritan, that's 45 minutes right there.
Mhm.
So we've got 45 minutes to play with in our mind.
Yes.
So we're doing it as fast as we can, and yes, it is to our advantage to have Banner Air because
Oh, that's great.
they're right there with us on site and a part of us, part of our team.
Mm. Well, that is great. Well, it is 10:30.
Oh my gosh, that's so fast.
Goes fast.
It certainly does, but this was great. Thank you so much Sheree,
Oh,
for coming
you're
on
welcome.
today and sharing, about quality management and what you do at Banner Payson Medical Center. Hoyt, thank you
Always a
so
pleasure.
much for coming in. I love just hearing about the different departments and their role in the hospital and how everybody works together to do the great job that you do.
Thank you.
So we appreciate
It's
it.
an honor.
Yes.
Thank you, yes.
Yeah, thank you so much. I'm glad you're in Payson, Sheree.
Oh, thank you. I'm so glad to be here. I feel blessed.
Yes,
Truthfully.
I feel we are. We're very blessed to live here in this community. It's
Yes.
a wonderful community, beautiful region, and I think everybody loves being here. So thank you, and thank you to all of our listeners. Thank you to everyone watching today on the KRIM FM Facebook page and YouTube channel as well. Hope you guys have a great rest of your day. And time to get back to the music with Buffalo Springfield, Genesis, The Who, and more. But first, let's get a quick update from the National Weather Service.
Genesis with
All right.
I'm a Genesis fan.
All right, guys. See you later.